Hello everyone, good afternoon. I hope all of you are doing well. I'm Dr. Vyshnavi, your ENT faculty, and today we are going to discuss instruments in ENT. So this is a score booster series. So basically it's for improvising your scores in NEET PG and FMG, because instruments are something that is very volatile and we tend to often get confused with the look of it, because we have to remember so many instruments from so many subjects, and so it becomes a little confusing. So here I'm going to concise the most important instruments that we require for your exams, for your NEET and for your FMG exams, so that there is no confusion. Here I have included all the instruments that have come in the previous years, so that you are revising even the previous year's instruments through this session. So if you're all able to get my relay absolutely all right, please confirm to me in the chat box so that we can start the session. So if the relay is okay, audio visual is okay, please confirm to me. Thank you, Dr. Prajwal Sharma. Thank you, Tawfiq. Thank you, SS. Thank you, Dr. Archie. And thank you everyone for confirming the same, that we are doing well. So this is going to be a quick 20-25 minutes max, 30-minute sessions, because I've put up 35 slides. So there's not going to be too much of, instruments that's going to bore you for an hour or so. This is going to be very quick, very crisp, very on to the point session, because we are here only to get a quick revision. The details of all these instruments are already on the app in a detailed version. So we are only going to revise so that you see the instrument, you recollect the instrument, and you're able to recall it in the exams as well. Chalo, let's begin. So I'll give you all a chance to identify what is this instrument, and then I will tell you the name. So if any of you know this, please let me know in the chat box. Can you all tell me what is the name of this instrument? Yes. Can you all tell me in the chat box what's the name? So this instrument basically is used to remove earwax. It is used for doing probe test. It is used for removal sometimes of foreign body in the ear. These are all the uses of this instrument. So can you all tell me what is the name of this instrument? So yes, so the name of this instrument is the Jobson Horne probe with a ring curette. So if you see, one end of it is having a curette, a round end. You see here, this is round, and the other end of it is serrated. It has got numerous serrations like this. So you can even remove wax. You can do a removal of granulation tissue. If you want to palpate if there is a mass, it's a soft polypoidal mass, or it's originating from the floor, or is it coming from the middle ear, all of that can be done with this instrument. So please remember, the name is Jobson Horne probe with a ring curette. So one end is a probe, the other end is a curette. So circular on one side, curette on another side. This is your Jobson Horne probe with a ring curette. Chalo, let's go to the second one. Can you all tell me what is this? This is something that you have already seen. We have done Rene's test with this. We have done Weber's test with this. We have done absolute bone conduction test with this. What is this test that what is this instrument that we commonly use in the OPD? So I say everyone is answering tuning fork. That I know everyone will know it's a tuning fork, but can you tell me what is the name of this tuning fork? This is called as a Hartmann's tuning fork. So this I'm sure everyone will remember, because देखते ही समझ में आ जाएगा तो ये tuning fork ही है, but इसका नाम हम भूल जाते हैं. So इसका नाम है Hartmann's tuning fork. So remember, the name is Hartmann's tuning fork. ठीक है? So this is clear. We do all the tuning fork tests to assess the hearing loss with this tuning fork, which is called as your Hartmann's tuning fork. Chalo. Now, anybody wants me to discuss anything beyond this regarding Rene's, Weber's absolute bone conduction test? So quickly, what is normal in Rene? Rene is positive. What happens in conductive hearing loss? Rene becomes negative, and in sensory neural hearing loss, Rene is positive. So this is the findings that we see on Rene's test. Weber's test, normal is equal lateralization on both the ears. In conductive hearing loss, it goes towards the same ear, and in sensory neural hearing loss, it gets lateralized towards the opposite ear. In absolute bone conduction test, if it is shortened, then we say that the patient is having SNHL on that side. So very simple, very easy. So let's go. So most commonly used frequency, Amal, is going to be 512 hertz because that's the frequency where there is maximum resonance. And second thing, it falls in midway between our speech frequencies, which is why we use 512 hertz tuning fork. So it has got minimal, it has got minimal resonance at that point, and that is why we use Hartmann's tuning fork 512 hertz. And because it's in the speech frequency in the midway, we use the 512 one. Of course, we use 256, 512, and 1024 as a routine for evaluation of tuning fork test. So you should be knowing even Rene's inference. What happens if Rene is positive in all the three? What happens if Rene is negative on 256, positive on 512, and 1024? How much is the hearing loss? So that question I'm sure all of you know. If you don't know, let me know. I will discuss it. I'm hoping that you all know. So I'm going to the next instrument. Can you all tell me what is this instrument? This is used for identifying. The first thing is it is used to identify the mobility of the tympanic membrane. So if the tympanic membrane is mobile or not, we use this. The second use of this is to perform a fistula test. What is a fistula test? We do this test where we put pressure in the canal and we see if the patient is experiencing vertigo or nystagmus. It usually indicates that there's a communication between the middle ear and the inner ear. So what is this test and what is this instrument? Amal, Brown's test is a test where we again put the same thing, same instrument in the external auditory canal and increase the pressure in patients who have this glomus tumor. What will happen? The tumor will become pale. That sign we call it as Brown's sign. So Brown's sign is seen in glomus tumors, and that is again done with this same instruments. Very good factor. This is called as Siegel's pneumatic speculum. So what is this called as? This is called as Siegel's pneumatic speculum. So we insert this speculum end into the external auditory canal, and this is the cuff with which we increase and decrease the pressure in the canal. So I hope all of you got it. The name is Siegel's pneumatic speculum, and what is it used for? It is used for assessing the mobility of the tympanic membrane, for fistula test, and of course in glomus to do the Brown sign. So this is a similar instrument, but instead of the Siegel speculum, what do we have here? We have an otoscope. So what is this instrument called as? Otoscope. So with otoscope, what do we get? We get a magnification also, and with the magnification, we can visualize the mobility better. We can visualize the signs better. So this is nothing but the otoscope with a pneumatic attachment, meaning we can do the otoscopy and at the same time we can do the same thing, visualize the mobility of the tympanic membrane. Now can you all tell me, this is a very common instrument that we use in ENT OPD. This can be a potential question for all of you. So can you all tell me what is the instrument that you see here? Number one, I'll tell you the uses. It is used for what? It is used for removal of wax. It is used for removal of non-hygroscopic foreign body. This is used for removal of non-hygroscopic foreign body. No, this is not oral toileting. So in oral toileting, we use the Jobson Horne probe with the curette I had shown you in the first slide, right? We put cotton around the probe and with that we clean the pus, or we can even do suctioning and clean the pus. In patients who have pus in the external auditory canal, you will never do syringing, as this can increase the infection further, and if there is a perforation through which the pus is coming, this infection can go to the middle ear and aggravate the disease. So this is contraindicated. The procedure that is being shown here is syringing, and syringing is contraindicated in patients with tympanic membrane perforation. So factor 5, I hope you got the answer. It is contraindicated whenever there is a tympanic membrane perforation, and especially if you have an active discharge, you should not use this. So this is important that you should know. It should not be used in hygroscopic, meaning water absorbing foreign body, because if you do syringing, it will absorb water and aggravate, and it will make the swelling, the foreign body swell, and it will occlude the canal more. So you should do syringing only for non-hygroscopic foreign body. It should be used for removal of wax. Number 3, it can be done to identify or to do a caloric test as well. So in caloric test, we put warm water or cold water in the external auditory canal. Typically, it's not done with the same syringe. It's done with other equipment. But of course, it can be used to perform the caloric test when you don't have specialized equipment to do a caloric test. So this is clear? Yes. Yes, when we do caloric test, the inference is cows, and whenever you're doing syringing, the direction should be towards the posterior-superior canal wall. So direction should be towards what? Direction should be towards the posterior-superior canal wall, because if you do directly on the tympanic membrane, it can cause perforation. So that was about your syringing, and the instrument was called as the Simpson's oral syringe. Now let us see how many of you can identify what is this instrument. So you can see here there is an instrument here, there is a procedure being performed. Can you all tell me what is the name of this instrument? So this procedure can be performed in patients with ASOM, it can be performed in patients with SOM. What is this instrument? Yes, the procedure is myringotomy. I'm sure all of you are getting it right. So absolutely right. Myringotomy is the right answer. But can you tell me what is the name of this instrument? The name of this instrument is called as Politzer's Myringotome. So what you see here, this instrument is called as Politzer's Myringotome, and it is used to make an incision or opening in the tympanic membrane, which we call it as myringotomy. So in ASOM, there are 4 indications for performing myringotomy, which is if a patient presents to you with excruciating ear pain and bulging drum. Number 2 is incomplete resolution despite antibiotics. Number 3, persistent effusion beyond 12 weeks. And number 4 is ASOM with facial palsy. If these 4 indications are there, then you can do myringotomy. In SOM, you will wait and watch for 12 weeks. If it does not resolve, then you're going to do myringotomy. So in ASOM, you will do myringotomy in which quadrant? You will do it in the posterior inferior quadrant, and you will do a curvilinear incision. In SOM, you will do it in the antero inferior quadrant. You will take the radial incision. So I'm hoping that all of you got this. Let's go to the next one. Yes. So can you all tell me what is this? This is a a device that we have kept in the tympanic membrane so as to ventilate the middle ear and also allow the drainage of the fluid that has got accumulated in the middle ear. So what is this? Very good. This is called as a Grommet. Now you tell me that Grommet is done for both ASOM and SOM or only for SOM. Where do you do Grommet? Quick. Where do you do a Grommet? In both the conditions ASOM and SOM, or is it done only for patients with SOM? Yes, very good. This is done only for patients with serous otitis media. The Grommet usually falls off by itself between 3 to 6 months of age. If it doesn't fall off, then you will have to do a manual removal of the Grommet. So I think this is also clear. Now let us see the next instrument. This is a PYQ asked in INI-CET. This is also asked in NEET PG. This is also asked in FMGE. So this is an instrument that is a must know for all of you. So you see that the bone is being drilled. This is your mastoid bone, and to expose the mastoid bone, the skin and subcutaneous tissue are being retracted. What is the name of this instrument? Yes, this is a mastoid retractor. Absolutely right. I'm not saying this is not a mastoid retractor, but can you tell me the name of this mastoid retractor? Very good, Wizard. Factor 5, very good. The name of this instrument is Mollison's self-retaining hemostatic mastoid retractor. So what is the name? Mollison's self-retaining hemostatic mastoid retractor. But how do we recognize this instrument is the most important question that we should ask ourselves here. So if you see the instrument, it has got equal number of prongs on the handle. So if you see on this handle we have 3 prongs, on this handle we have 3 prongs. So if there is equal number of prongs, so if I say 3 by 3, which means that on each arm there is equal number of prongs, then it is Mollison's. It can be 4 by 4 also. Okay, so the number of prongs are same on both the sides, then you will say that it is Mollison's self-retaining hemostatic mastoid retractor. Now look at this image and tell me, is this Mollison's? Look at this image and tell me, is this Mollison's self-retaining hemostatic mastoid retractor? So you see on one side there are 1, 2, 3 prongs. The other side also 1, 2 and 3 prongs. But what is the difference? You see, is one prong longer than the other 2 prongs? Yes, here we have equal sized 1, 2 and 3. Here we have 1, 2 and 3, but is one prong longer? So when you have a longer prong, what will you call it as? You will call it as plester. So plester has L. So plester's retractor is a retractor which has one prong which is longer than them. So it is same 3 by 3 but one prong longer. So remember, this is how you remember it, that if one prong is longer, then it is plesters. Same 3 by 3 equal, then it is mollisons. Now look at this mastoid retractor. See, they all look the same and you can get confused in the exam. These are the hints that we're going to recollect and be able to solve in the exam. Now look at this retractor. Here we have 1, 2, 3, 4. We have 1, 2, 3. What is the answer here? Here we have 4 prongs on one side, 3 prongs on another side. So 4 into 3, unequal number of prongs. What will we call this as? Anybody? If there are unequal number of prongs, what will we call this as? We call this as Wheatlander's retractor. So a quick tip for all of you to remember. So if it is 3 into 3 or 4 into 4, which means that there are equal number of prongs, the name is mollison. If you have 3 into 2 or 4 into 3, which means unequal number of prongs, reverse M, you get W. So you call it as Wheatlander's retractor. Okay, that is how I remember it. You can also remember it that way. If you have same 3 by 3, 4 by 4, but one prong is longer, then what will you call it as? Plester's retractor. So remember that it is Plester's retractor. So this is how you're going to remember important things here: Plester's, mollisons, and Wheatlander's retractor. Easy now, everybody? Can you all recollect the retractors very easily whenever you see it? Yes? Okay. Now let us see this. Here we have, of course, equal number of prongs, but look at this. At the handle, we have, instead of putting the space for putting your fingers to open and close the retractor, we have a knob to open and close the retractor. So what should be the name of this retractor? This is called as Janssen's mastoid retractor. So here in the previous retractors, we had handles where you could accommodate the fingers to open and close. But here what do we have? Here we don't have that handle to open and close. Instead, we have a knob to open and close. What is the name of this? This is called as Janssen's mastoid retractor. So I'm hoping all of you know this. Now let's quickly test. All of you will answer to me in the chat box. 4 into 4. What is the name of the retractor? 4 into 3. What is the name of the retractor? 4 into 4 plus, but one prong is longer. What is the name of the retractor? And if you have got a knob instead of the handle, what is the name of the retractor? Very good. So the first one is going to be your mollison self-retaining hemostatic mastoid retractor. 4 into 3, I told you, reverse M. What will you get? Yes, this is going to be called as Wheatlander's retractor. Then if you have 4 into 4 but one prong is longer, what will you call it as? Plester's retractor. And last, if you have a knob, we call it as Janssen's retractor. So in the last, if you can just recollect this much and go to the exam, then also you should be able to answer the questions regarding mastoid retractor. And mastoid retractor is a constant question that keeps coming in all your exams. Maybe the other instruments that I'm discussing are not so important, that are good to know, but mastoid retractors are a must know because they have already come in the previous years and you cannot make a mistake. Okay, now the last type of retractor which we are going to learn. So we've learned 4 perfectly. Let's go to the last one. Here you see that there is only one prong on one side and there are 3 prongs on another side. What will we call? See, you see, does this resemble alphabet E? Only one prong on one side, but other side you have 3 prongs. What will we call this retractor as? Perkins retractor. Easy. Plester had one prong longer, so we call it as plesters. Now here, because we have alphabet E, what will we call it as? We will call it as Perkins retractor. So 1 by 3 will be your Perkins retractor. Easy? Easy, everybody? So if you have one prong longer, then it is going to be plesters. But if you have only one prong on one side but 3 on another side that resembles alphabet E, then you call it as Perkins. I hope everyone got this. Yes, so this is called as Perkins mastoid retractor. So that is easy for all of you. Now again, we'll go to another instrument that has come in the previous exams. Can anybody tell me what is this instrument? I'll tell you what is the use of it. Meanwhile, till you answer in the chat box. It is used for anterior rhinoscopic examination. So it is used for anterior rhinoscopic examination. You can use it in the OPD. You can use it in surgeries as well. Yes, very good. This is called as Tudicum's nasal speculum. Is this self-retaining or non-self-retaining? It is a non-self-retaining speculum. So if you see, you have to open the speculum, then only it will open the nasal ala to visualize the nasal cavity. So it's not a self-retaining speculum, it's a non-self-retaining speculum. Now compare this with the other speculum that you see here. Here there is a screw that will keep the prongs open, the blades open like this. What do you call this speculum as? That is again used for anterior rhinoscopy. It is also used for septoplasty. What is the name of this speculum? What will you call this as? You will call this as Killian's laser speculum. Now you can have a long blade, you can have a short blade. So the name will be Killian. So the name of this speculum is called as Killian. So Tudicum's is non-self-retaining, Killian's is self-retaining. So this screw that we have here, when we tighten the screw, it will open the blade so that it can help, it will stay open by itself, and you can give the assistant to hold the speculum and do your surgery with your both hands. So this is your Killian's laser speculum. Now let's go to the next instrument. Very simple, very commonly asked. Again, this is something that you do in the OPD as well. What is this one? What is this instrument? What is this mirror called as? So you can see there is a tongue depressor and you're using a mirror. This mirror is going to be placed behind the uvula to see the structures of the nasopharynx. What is this? So Kanishk, look at the mirror. First of all, it has a bend, and second thing, the mirror is facing upwards, not downwards. So we are trying to visualize the back end of the nose because the mirror is facing upwards. So what is this called as? This is called as St. Clair Thompson posterior rhinoscopic mirror. So what is the name? St. Clair Thompson posterior rhinoscopic mirror. So whenever we want to visualize the nasopharynx, we use this mirror, which is called as St. Clair Thompson posterior rhinoscopic mirror. Okay, so remember that ideal mirror does not have a bend, whereas a St. Clair Thompson mirror has a bend. The mirror faces upwards, but here we are seeing in ideal we would see the mirror facing downwards. Now look at this image and tell me what is the name of this instrument. So this is used to reduce fracture of nasal bones. So can you tell me what is this instrument used to reduce the fracture of the nasal bones? See, this one has a guard because when we are putting this instrument over the nasal bone, we do not want an injury to happen over the eye. So we keep one prong on the outside and another prong goes inside to reduce the nasal bone. So what is this called as? Yes, very, very good. This instrument is called as the Walsham's forceps. So in Walsham's forceps, we do not see any bend happening here. It is a straight forceps. So this is called as your Walsham's forceps, which is used to correct any fracture of your nasal bones. Now let us see an instrument which is similar to that of your Walsham's forceps, but it has an angle here. What is this angle? Angulated one. So remember, angulated one is going to be your Ashes forceps. And what do we use this Ashes forceps for? It is used for fracture of the nasal septum. So whenever you want to reduce the fracture of the nasal septum, what will we use? We'll use this Ashes septal forceps. So now it's easy. These are again very important instruments that you should know for your exams. So nasal bone reduction is Walsham, angulated is Ashes. For your anterior rhinoscopy, you will use Tudicum's nasal speculum. For posterior rhinoscopy, you will use St. Clair Thompson posterior rhinoscopic mirror. Mirror has an angle. Okay. Now let us look at this instrument. Can you tell me what is this instrument? This is used for performing tonsillectomy most commonly. This can be used for performing even adenoidectomy, because if we are going transoral and doing the adenoid removal, then we require this. We can also use this for doing any procedure of the tongue base, of the palate, of the oropharynx. We use this instrument. So can you tell me what is the name of this instrument? Anybody? So this is your Boyle-Davis mouth gag and this is the Russell-Davis tongue blade. So this is your mouth gag, which will open the mouth, and the tongue blade, which will retract the tongue downward so that you can get a good visualization of the oral cavity and the oropharynx. So if you see here, this is the patient's head end. that you see here. You see this is the upper part of the Boyle-Davis mouth gag that is retracting your upper jaw like this, and the lower part and the lower jaw is held downwards by the tongue blade. So this entire complex is your Boyle-Davis mouth gag. You can see the uvula, you can see the palate, you can see the oropharynx, you can see the tonsils when you open the mouth this way. Now, if this has to be stabilized, it has to be stabilized on this bipod. What is this bipod called as? Anybody? What is this bipod called as, which is used to stabilize the mouth gag? See, of course, you want your hands to be free, not just one hand, both the hands. So you don't want to hold the mouth gag, and you don't want to give it to an assistant because they will keep moving and it will impair your view. So once you have fixed, you want it to be there like that. So you're going to take this bipod stand. This is called as the Draffin's bipod. Okay, so what is it called as? This bipod stand is called as Draffin's bipod. That will fix the mouth gag. And this Draffin's bipod below the neck, we have to stabilize it on a plate. This plate is called as Megoran's plate. So whenever you're doing a tonsillectomy, an adenoidectomy, or any surgery, first thing is you open the mouth with the help of this mouth gag. You stabilize with the help of this Draffin's bipod. This Draffin's bipod goes on a plate which is below the neck of the patient. So you can see here there will be a plate that is called as the Megoran's plate. Okay, so simple. Megoran's plate, Draffin's bipod, Boyle-Davis mouth gag are the instruments that we start off for doing any tonsillar, palatal or adenoid surgery. So can you tell me what is the name of this instrument, or at least what is the use of this instrument? You can see here there is a curate. It is used to remove what? Yes. So this is called as St. Clair Thompson's adenoidectomy curate. Yes, very good. It is used for removal of adenoid. Nowadays, we don't do adenoidectomy by curettage. We use coblator, we use radio frequency, and under vision, we try to remove the adenoid so that we do not damage any tissue. But in the olden times, when they didn't have endoscope camera system, they would use with this curate, which is called as St. Clair Thompson's adenoidectomy curate. Do you remember St. Clair Thompson was used somewhere else also? Where did we use this word St. Clair Thompson? Was this used for posterior rhinoscopy as well? Yes. So for posterior rhinoscopic mirror, we use St. Clair Thompson, and posterior rhinoscopy would show you adenoid. So to remove the adenoid, what will you do? You'll take the same name of the instrument, which is called as St. Clair Thompson adenoidectomy curate. So isn't it very simple that whenever you think of St. Clair Thompson, remember adenoid, which is in the posterior part of the nasopharynx. Done? Okay. Now this instrument is used to dissect the tonsil and to visualize the tonsillar fossa. So this instrument here, this part is used to dissect the tonsil. This is called as Mollison's tonsillar dissector. And this end is used to retract the anterior pillar. So if you see here, this is your anterior pillar. So if I want to see the fossa of the tonsil or bed of the tonsil, if there's any bleeding point, a bleeding vessel, then I need to retract this to get this away. So to retract that, what will I use? I'll use this anterior pillar retractor. So tonsillar dissector and anterior pillar retractor are remembered with the name word Mollison's. Now, can anybody tell me what is this instrument? So when we are doing a tonsillectomy and we have dissected off the tonsil, meaning we are dissecting the plane of the tonsil, and as we keep going towards the lower pole, what will happen? We will have a pedicle here and the tonsil hanging like this. Now we want to crush and cut this pole, lower pole. What is that instrument which will cut and crush the lower pole of the tonsil? This instrument is called as Eve's tonsillar snare. So this is the snare, the tonsillar tissue which is held by a tag like this, and then when you pull the snare upwards like this, it's going to crush and cut the pedicle of the tonsil and thus do your tonsillectomy. So this is used in the final step after you have completed the dissection of the tonsil from the upper pole to the lower pole. So the name is Eve's tonsillar snare. Now this is again a very common instrument that you use in your exams. What is the name of this instrument? Kanishkraj you can use in adenoid, but the problem is adenoid, we don't dissect it from the upper pole to lower pole to get a pedicle or a tag which can be cut or crushed. In adenoid, it is like a bag of worms. So we have to just curate it off to remove that tissue. Okay, so here in adenoid, we don't use snare. Okay. So can you tell me what is this? Yes, this is called as lax tongue depressor. So this tongue depressor is used for performing any of your intraoral examination to visualize the size of the tonsil. Is there any tonsillitis? Is there any pharyngitis? So for that we use this instrument which is called as your lax tongue depressor. Now comes the instrument that you've been telling to me all this time. When you see the instrument, there is a mirror, but look, is there any angle here? It is a non-angulated one. So if it is a non-angulated one, what will be the name of this instrument? It is used for performing which procedure? Yes, very good. This is your IDL mirror. So in St. Clair's Thompson, we saw there was an angle. In IDL mirror, there will be no angle. So it is direct, there is no angle, and this is used for performing indirect laryngoscopy to visualize the larynx. Great. Now, if we want to visualize the larynx directly, we can use this laryngoscope, which is called as the direct laryngoscope. So from this end, you will start to visualize, and this end goes downward from the oral cavity to the larynx, and you can visualize directly the larynx. So this is called as your direct laryngoscope. So if you see here, this instrument is your clean saucer suspension laryngoscope, which is used for all the vocal cord surgeries. So what do we do here? You see here, this is the laryngoscope that is going to be inserted via the mouth of the patient, and this will go onto the larynx. So this part of the instrument is going where? Via the mouth. It is going and getting stabilized on the larynx. Now the other part of the instrument is kept. Second. Yes. So if you see, the other part of the instrument is stabilized with the help of the chest piece, so that this entire system becomes one complex, and the examiner or the surgeon has both the hands free to perform his laryngeal surgery. So we are suspending this laryngoscope with that of a chest piece. So this is called as the clean saucers suspension laryngoscope for microlaryngeal surgery. Okay, this is called as a barking dog position. Okay, so this is called as what position? Barking dog position. Okay, in tonsillectomy we use rose position. Here we use the barking dog position. Okay, yes, the chin is up and the neck is extended. That's right. Next question, what do you see here? This is used for a procedure where we make an opening in the trachea. After making an opening in the trachea, we want to dilate this opening. So what is this instrument called as? This is called as your Tracheal dilator. So it is used to dilate the opening that you have made in the trachea, so that you can easily insert your tracheostomy tube inside the trachea. So this is called as your tracheal dilator. Then we have the last two images for discussion. The first one is your head mirror, which is no longer used because we have got high illuminating headlamps, and we have the headlights that will give us a good illumination. We don't need indirect reflection. But in the olden times, or if you see in some of the government college OPDs, you will still see this head mirrors, and this head mirror basically will reflect the light coming from the bull's eye lamp, and the mirror slide that is getting reflected is put on the target site, which is on the patient. So the names are very important, the head mirror and the bull's eye lamp. So with this, I finish my session on the most basic and the most important instruments in ENT. So I just wanted to keep it very simple, very easy, so that you can revise it also at a later point of time. And before you go to examination, just have a quick glance of it in 2x speed, where you'll finish this entire session in 10 to 12 minutes. And I'm sure that at least one question will turn up in your exams, because that is what we are seeing in the last few years. So all the best, and if there are any queries, please let me know in the chat box. I'll be more than happy to help you. Yes, so thank you everyone. Have a nice day. All the best. Study well and take those little tiny steps. And I'm sure that your final goal, whether it is NEET, FMG, or INI, you will be able to crack it. It's just that you will have to keep your momentum going and you'll have to have that perseverance of, I will do it, I'll achieve it. And at no point of time you're going to give up. The moment you feel I'm going to give up, you're going to push yourself up, pull yourself up, and keep going forward. So all the best, take care, and bye bye.